Hello, my name is Dr. Caton, physical therapist. Today I'm going to talk to you about tennis elbow. So lateral epicondylitis, more commonly known as tennis elbow, is a common painful syndrome related to the lateral side of the elbow along the extensor muscles. So what happens is these muscles get overused, overworked, and a tendinopathy occurs. Tendinopathy is just a fancy word for either tendinitis or tendinosis. And so when these muscles get irritated and we don't allow proper time to heal, and so we're overusing those muscles, it leads to pain, inflammation, and weakness. So the symptoms of this condition are initially you're going to have pain after activity, so not during, but a few hours after a triggering activity. People usually report pain near the lateral epicondyle of the forearm and the elbow. And then over time, as that progresses, you're going to begin to have pain near the end of activity, during activity, and then in severe cases, you're going to have pain even at rest. Now the pain can stay local to the elbow region, or it can radiate down the forearm into the hand. There also may be numbness or weakness present. So despite the name of tennis elbow, actually only 5% of cases are related to racket sports. It's more commonly occurs by people who do gardening, manual labor. A lot of people are staying inside and working on the computer a lot more now, so that's often a big cause of this condition. Also overhead sports, but basically any repetitious activity involving the hands, wrists, and forearms can potentially cause this condition. As a physical therapist, how I would go about diagnosing this condition is I would first take a thorough subjective history from the patient. So I want to know when the pain began, other symptoms they might have, daily activities, hobbies, what they do for work. I also want to assess range of motion at the wrist, strength. I may palpate the area and see if it's tender to touch. I'm going to check if they have pain if I resist wrist extension. So if I work those muscles, if that elicits more pain, that's another sign that points to me that someone may have this condition. I'm also actually going to screen their cervical spine or their neck, because oftentimes issues at the neck can cause referred pain or radiating pain down to that elbow and can be mistaken for tennis elbow when actually the problem is coming from the neck. The good news is that even in the most severe cases of tennis elbow, almost all of them fully resolve within a year, and minor cases obviously can resolve much quicker than that. As far as treatment, it's going to begin with first modifying your activity to eliminate what the triggers are. So if it's on only one side and it only occurs, say, when you're doing computer work or gardening, using a hammer, hand tools, things like that, we may modify to use the other hand a bit more, or try to find a way to just cease those activities and give the muscles in the area and the tissues time to heal. After that, what we're also going to be doing is potentially some manual work, so some cross-friction massage, other techniques. We're going to also perform some gentle stretching. We're going to perform isometric strengthening and then progress that to higher levels of resistance and try to toughen up those tissues so that they don't get overworked once you return to your normal activity. I hope you found the video helpful, and thank you for watching.